The pandemic's negative impact on mental health has been widely discussed by experts, but there's been a lack of data specific to how this has impacted the LGBTQ community. Folks that identify as lesbian, gay, bisexual, trans, and/or queer have a history of stigma and discrimination, and were already excluded from an inaccessible mental health care system with a lack of queer competent providers. A recent poll found that 3 out of every 4 LGBTQ people reported that pandemic-related stress has had an impact on their mental health, compared with under 50% of non-queer counterparts. In addition, more than half of queer households experienced a job loss or furloughs. COVID-19 has exacerbated the situation by furthering the inequalities and shattering any sense of connection to community, which has been identified as a protective factor for the queer community. However, the pandemic has forced mental health to adapt for the good in some ways, and for the first time ever, embrace technology. As a queer individual, therapist, and practice owner that has worked in mental health for the past 6 years, I'd like to speak directly to 2 realizations that I've had working firsthand with the LGBTQ community during this pandemic. Realizations that highlight the beneficial role of technology while still revealing where therapists and organizations can do better in serving queer folks. Let's start with technology. 2020 quickly became the world of Zoom and video conferencing. Physical offices were forced to shut down. This included therapy spaces, though we quickly switched to 100% virtual work. Telehealth has made it possible for queer folks anywhere in New York to access mental health care providers. Before COVID, patients would physically need to travel to location, most likely into Manhattan, where the most queer providers are located. For those with time, money, and resources, great. But what about the vast majority that don't? Telehealth has enabled me, as a therapist, to connect with queer folks across all 5 boroughs and even larger New York State, which runs politically red compared to a very, very blue New York City. In addition to the accessibility of providers, telehealth has reduced barriers to attending and completing the actual appointment. I have seen the rate of no-show appointments drop to virtually zero. This means not showing up, missing your train, forgetting the appointment, right? However, there are the occasional internet and audio issues during session from time to time. And if you're like me, you may spend half of a day maybe fighting Zoom and praying to the internet gods. But overall, this rarely happens, and it means less obstacles to care, more time to carry out treatment, and better outcomes for the patient. Apart from the logistics of therapy itself, telehealth allows LGBTQ folks to show up as they are and present as their authentic self in session. Using video therapy has even reduced the rates that we're seeing of body dysmorphia in some trans and non-binary folks. For some, just the simple process of navigating a daily function like taking public transportation or using the bathroom are areas and opportunities for violence and discrimination. By meeting a client where they are physically at, therapy can truly be a healing space and perhaps the only part of someone's day where they can simply be themselves. Of course, one can argue virtual therapy has a different impact than in-person therapy, especially when you think about working with kids. However, research shows that telehealth is just as effective as in-person therapy. The positive gains in general access to queer competent providers outweighs any potential limitation around efficacy. Now for my second realization. I continue to be appalled by the stories I hear about therapists when I speak to my new patients. I do the initial consultations with all the patients that I meet and kind of learn a little bit more about what they're looking for in therapy and what has or hasn't worked for them in the past. How is it that in 2021, there are licensed trained professionals out there making queer folks feel unsafe from the very first conversation together? Asking them, well, are you a woman or are you a man? You have to pick. Or how do your parents feel about your lifestyle choice? And why are you choosing such a hard life? It would just be so much easier if you just didn't wear heels, married a girl, and got on with your life. Increasing access to therapists does not mean we're increasing the competency of those therapists to work with queer folks. Finding a therapist in general is overwhelming. So the quest of finding someone that will do more good than harm can feel like an impossible feat for the queer community. Limiting re-traumatization must be a priority during COVID-19 and beyond, which means advocating for affirmative psychotherapy. What is affirmative psychotherapy? Affirmative psychotherapy is a therapy stance where we validate and advocate for the needs of folks with diverse sexual orientation, gender identity, gender expression, and sex characteristics. It does not see LGBTQ status as an illness or something to target itself, but instead something to affirm, something to celebrate. As an affirmative therapist, I work with my patients to achieve their mental health goals, all while actively uplifting their identities. Also embedded in my practice is an effort to address the systematic oppression, homophobia, and other isms that my clients face. So what does this look like in therapy? It can manifest as a word choice, such as using a patient's pronouns and clarifying your own at the very first meeting. This is one of the quickest ways to create a safe and affirming therapeutic space. And trust me, it matters. P.S. We don't say preferred pronouns anymore. We just ask for your pronouns. Affirmative therapy can also look like asking questions in gender neutral terms, such as, do you have a partner versus do you have a boyfriend or a girlfriend? And also not assuming heteronormative ideas of relationships, such as monogamy. Ask about partners. And check your assumption that everyone is or needs to be sexual to be happy. Explore your own biases as a therapist and your ideas around sex work, kink, BDSM, and polyamorous relationships. If you don't, it's likely to come out during your session and at your patient's expense. Affirmative therapy also means that as a therapist, I'm aware of the systematic challenges my clients have to face, such as discrimination and the lifetime of invalidation, and I address these difficulties in session. This can mean coping with homophobia and transphobia in families, online, in the workplace, and even how our perceived fear of violence and judgment can hold us back. For example, why a client may be afraid of updating their pronoun on social media, or even I might be afraid of using they, which is my pronoun, in a work email. An affirmative therapist will recognize the larger narrative and life history around such seemingly simple action. We will validate that experience and understand, as opposed to saying, why can't you just do it? Or does it really matter that much? Can't you just wear the shirt that's going to make your mom happy at dinner? Apart from sexuality and identity itself, affirmative therapy recognizes the multiple cultural, social, political, and religious identities that a client might hold, such as identifying as queer and BIPOC, and openly discuss the impact of racism, capitalism, heteronormativity, and other forms of oppression, if, of course, the patient wants to go there. It is important to note that although the LGBTQ community is united by social struggles that all members face, each subgroup has its own specific needs and concerns, and affirmative therapy addresses these needs. Don't say, I work with gay people, or that I'm LGBTQ competent if you only have worked with or feel comfortable working with white, gay, cisgender men. There are many ways affirmative therapy can look like in session, and a lot of research is currently being done to hone in and expand on this very concept. So what can you do about it? What can you, as a healthcare leader, organization, or even a future practitioner, do to ensure accessible and quality services for the queer community? First and foremost, continue to offer telehealth services after COVID to enable as many folks as possible to reach the care that they deserve. There is no reason that virtual therapy needs to stop. However, confidentiality is huge, and not all folks can safely discuss their mental health needs, let alone their identity or sexuality in their household. Consider maintaining a blended model of both in-person and virtual services. Number 2, paperwork matters. Formally review any paperwork that you have, especially intake documents or a place you collect client or user information? Does your paperwork include a line for pronouns, multiple ways of defining sexual orientation and gender identity? And is there a place to distinguish the name that you go by from your legal name if they're not the same? As an organization, do your employees in general include their pronouns in their email signatures? Is this something that you could discuss? All these things make a huge difference. Number 3, foster community internally and externally. Consider adding virtual groups specifically for LGBTQ folks. Restoring a sense of community and allowing for the safe expression of self is essential to combating the isolation felt by many queer folks during this pandemic. At the organizational level, think about how you are building community in your own area. Are you referring out to queer competent psychiatrists and primary care doctors? Are you aware of the closest LGBTQ community center in your area? Right? Identify ways that you can build and strengthen partnerships, especially before you may need to use them. Number 4, create an organizational plan. What is your organization's plan for serving the queer community? How are you expanding access and otherwise making your safe space? Create a specific plan for training staff competencies, if you're working in therapy, in this affirmative psychotherapy. Or consider bringing in queer speakers or DEI consultants to facilitate these types of discussions and compensating them appropriately for their lived experiences. Start by working on yourself. Check out the Harvard's implicit association test to identify your own biases toward this and other groups. You have a choice. How will you go back to your organization, the work that you do, the therapy that you deliver, and take committed action to include, protect, and celebrate LGBTQ people? Take a minute now, close your eyes, think about the work that you do. Whether you're a social work student, a marketing specialist, or a CEO, identify at least one area in your own work that you can improve on, like reviewing your own biases, starting to share your own pronoun, or rethinking the narratives you reinforce about queer folks in your social media campaigns. Now, think about your organization. Identify one area where your organization can improve. Who would you need to enroll in your vision to carry this out? Do you need to navigate a problematic manager or an office policy? What is stopping you? I get it. Sometimes we can't control things in our agency, and we may fear rocking the boat at the expense of keeping our own job. But we're talking about ideas here. And all I'm asking you to do is start the conversation. And honestly, if your organization can't handle the respectful sharing of ideas, then I think you have some other organizational culture issues to target. But obstacles aside, is it your own fear, your own discomfort that is holding you back? Y'all, we are here to make an impact, right? That's why we're all at this summit. We want to create a change, a better world for all folks, regardless of sexual orientation, gender identity, and gender expression. The question is, will you?